In order to understand the broader population control agenda and how it ties into the Gates Foundation's plans, we have to look at a puzzling development that took place in 2017. In that year, Gavi, the Gates-founded and funded alliance that partners the Gates Foundation, the World Health Organization, and the World Bank with vaccine manufacturers to help ensure healthy markets for vaccines, took a strange pivot away from its core mission of vaccinating every child on the planet to providing every child with a digital biometric identity. The idea was first floated by Gavi CEO Seth Berkley in a Nature article that year, Immunization Needs a Technology Boost, where he states that the goal of 100% immunization will not be reached without secure digital identification systems that can store a child's medical history. He then gives a specific example. We are working with a company in India called Kushi Baby, which creates off-grid digital health records. A necklace worn by infants contains a unique identification number on a short-range communication chip. Community health workers can scan the chip using a mobile phone, enabling them to update a child's digital record even in remote areas with little phone coverage. This sudden interest in digital identity was no mere passing fancy for the Vaccine Alliance. Gavi doubled down by becoming a founding member of the ID 2020 Alliance, a public-private partnership dedicated to spearheading a global digital biometric identity standard. Other founding members of the alliance include Gates' first company, Microsoft, and the Rockefeller Foundation. In 2018, Gavi issued a call for innovation in digital technologies for finding, identifying, and registering the most vulnerable children. The call specifically requested technologies for capturing, storing, and enrolling the biometric details of infants on rugged biometric devices. Berkeley continued to follow up on this idea in public engagements as one of the new core missions of Gavi.
What's interesting is that people tend to think of, birth certificates as kind of a major document, but, the most common, as I mentioned before, is not a birth certificate, is not a death certificate, is not a marriage certificate. The most common connection, vital registration for the population is actually a child health card, because we reach more than 90% of children with at least one dose of vaccine as part of routine. So they're in the system. The challenge is that contact is not connected into the system. So if you could connect it, then you have the ability to give them their basic identity papers. You have ability then later on, if they want to own land or they want to have their rights, you're able to help them with that. But, we're not currently taking advantage of that. And so the children get seen, they get enrolled in the health centers, but that information is not used for anything else.